All right, everyone, we're going to officially start this program. My name is Rose Gerber. I'm the Director of Patient Advocacy and Education for the Community Oncology Alliance. Thank you again for joining us on this important topic. When we say important, it doesn't always have to do with healthcare policy. As you can see from the agenda on the screen, the topic for today is nutrition, and I love the fact that it's evidence-based nutrition. But before we get into today's agenda, I wanted to let you know that COA recently issued a press release showing our support for the Help Co-Pays Act. This bipartisan bill helps ensure patients are protected from actions that raise their patient costs. Visit the COA website to read our full press release and gain further insight into the growing problem of patient copay accumulator programs. Now it's time for us to get into this important topic about nutrition. And I'm guessing that many of you may relate to what I think about with nutrition is I tend to think about it the most during January. That's because it's after the holiday season and all those Super Bowl parties and all that temptation. I kind of think it starts between October through January. I think that's like the most challenging time of the year. But did you know that March is actually National Nutrition Month? So, well, I said I tend to think about this topic the most. I mean, I think about it year round, but especially in January. There's professionals and just people that do the right thing, and they think about nutrition year round. And our special guest today, Jennifer Lafferty, is one of them. But what is so important about this topic, again, and timeliness being National Nutrition Month, is that for the general public, a lot of us are obsessed. I think probably women, just because I know that women talk about nutrition a lot. At certain times of the year, but for the general population, this is just a very challenging topic for a lot of people. But it's especially important for cancer patients. And by the way, just a reminder that we do have a little chat section where you can share maybe some of the issues that if you are a cancer patient or a caregiver or a long-term survivor, maybe some of the issues that you went through your own cancer journey. And Jennifer is going to talk to us about how important this is. What are the nutritional challenges for patients, whether they're newly diagnosed or a long-term survivor like myself, who I still have those challenges, how to manage these symptoms. And then what's really interesting too is Jennifer is going to talk to us about advocacy related specifically to medical nutrition therapy. And now I've said her name, Jennifer, many times, and I guess if you're really close to her, you can call her Jen. She is a registered dietitian and the Clinical Oncology Nutritionist Supervisor for the American Oncology Network. Many of you know the American Oncology Network as AON, and they represent community oncology practices as well, independent practices, and I really love working with them. They have very talented staff. And Jennifer, I am now going to turn it over to you. So we look forward to learning from you today. Welcome.
Welcome. Well, thank you so much, Rose. I am so happy to be here. I mean, not only is it National Nutrition Month, but today is actually Registered Dietitian Day. So I appreciate having something special to do today and be able to talk to people about this topic, which is, both professionally and personally important to me. So we can get started with my slides. All right, so let's go ahead to the discussion outline. So we'll start off, I just want to touch on some of the common nutrition concerns and outcomes all along the continuum of cancer. Then we'll get into the World Cancer Research Fund and American Institute for Cancer Research's diet recommendations for the prevention of cancer, as well as for survivors, including survivors in treatment, as long as they can manage these recommendations. And then we'll get into the things that make it challenging for patients kind of in the thick of things. We'll talk about the common nutrition impacts symptoms and how we oncology dietitians work with patients through that. Our goal is to prevent and treat malnutrition. So we'll get into that a bit, and then I'll talk about the Medical Nutrition Therapy Act in our advocacy section. All right, next slide. Now this one, it's a little wordy. but it lists on top, in the top column, you can see the continuum of care for cancer. So prevention, diagnosis, and onto survivorship. And there are potential nutrition concerns and potential nutrition outcomes. And I won't review all of this, but what I want to illustrate is that wherever you fall along the continuum, it is important how you nourish your body, and you can make a big impact on your health and well-being with food at any stage. So, you know, I often have people feeling like, I should have done this, I should have done that. It never is too late. There is always a role, and it's never a bad time to concentrate on nutrition as part of your therapy, and to want to better nourish yourself. Okay, so let's get into the recommendations. Go to the slide that says drink mostly water. So the first one of the recommendations is that we need to really look at what we're drinking, because this is a source of very easy energy in terms of calories and sugar, but not a lot of nutrients. So particularly those sugar sweetened beverages like sodas and lemonades and energy drinks. This is one area that is directly related to weight gain and body fatness, your body composition. And we'll get to that later, but that is actually the second leading modifiable risk factor for cancer. And so this is one of the food groups that contributes to that. So we really want to focus on what we drink, choosing, you know, more water, sparkling water, unsweetened teas. There's a lot of stuff on the market now, so this is a little easier than it used to be, because we do have so many options here. And I do apologize. I'm gonna do all the limit and avoid stuff first so that we can end on a high note and talk about what we should eat more of. But I did kind of put in blue like little tips or what you can do instead, because I know this gets awful to be feel like you're cutting everything out. But like I said, there's so many options here. I think this one isn't too bad anymore. All right, next slide. All right, in the same way that those sugar sweetened beverages contribute to cancer indirectly through the effect on our body fat and weight gain, so do fast and convenience foods, what we would call highly processed foods. People get very confused in this area, so I just want it. Minimally processed foods are okay. So it's okay to eat bran cereal and bread that's made with flour, and it's okay to make applesauce out of apples. That's really not what we're talking about. When we talk about limiting processed foods, we are talking about these things that add excessive amounts of fat, sugar, and salt, whether to flavor the food and make it taste good or to use as a preservative. For those reasons, the foods tend to be, abundant in calories, really low in other nutrients, and they're often served in portions that are also excessive. So the positive end here is that we want to focus more on minimally processed foods, snack on fruits and veggies, keep healthier foods on hand so we don't, gravitate towards these foods. Another area where, we are seeing now more, what I would say are more fast and convenience items that are a little healthier. So reading labels is a tip here to compare when you are buying things in the grocery store.
Jen, I want to ask something. I'm just because the fruit and vegetables, I love fruit, but I know I won't name a program, but one time I was on a weight loss program and like eating fruit, there was like, don't eat so much certain fruits because they add sugar.
Sure.
And it was so stressful. It's like, oh my gosh, I can't eat fruit. Like I felt like anything I was trying to eat was bad. So like, what's the thinking on fruit now? Because certain fruits have too much sugar.
Right. Yeah, we get this. This is a really common question, and we do have lots of patients coming to us that are very proud that they've cut out fruit. We do not recommend restrictions on fruit. You can eat any type of fruit. Like everything, nothing is unlimited in the diet, right? but the benefits of fruit, it's not just sugar, right? There's fiber, there's moisture, there's water, or they're high moisture, high water foods. They are loaded with antioxidants and phytochemicals, which we're going to talk about more. So we don't like to see patients restricting that food group. We're going to get more into fruits and vegetables, but they are loaded with cancer-fighting natural substances. So we don't want to see that. Of course, nothing is unlimited. You want to eat fruit several times a day, right? But yes, we don't like to see the fruit-free diets, which we have unfortunately seen a lot of that with some popularity of certain bad diets and things. We want you to eat your fruits.
Thank
So
you.
let's hit the next slide, please. All right. Okay, so then like I said before, the reason we want to limit those types of foods is because they contribute to all of these types of cancer that you see listed there on the left. And like I said, after tobacco, managing your body weight is the next best thing you can do in terms of modifiable lifestyle factors that you can work on to help reduce your risk for cancer and recurrence. Reason for that being that having too much body fat can lead to chronic inflammation. It can lead to an irregular hormonal environment between estrogen and insulin, and promote disease, including cancer. So that's kind of where the restrictions on those two food groups come from. It's not what we often hear where patients will say, well, I heard that sugar feeds cancer, so I'm not eating fruit, for instance, or I'm cutting out sugar. We're not looking at a direct relationship like that. It's more complex. It's more eating these foods leads to an increased risk for an unhealthy body weight, unhealthy body composition. It crowds out healthier foods in the diet, so you're not getting those really more protective nutrients. And so that is more of the relationship there. All right, next slide. All right, so this is another one we get asked a lot about. So studies do show that diets that are high in meat tend to crowd out healthy foods like grains, fruits, vegetables, beans, and that once your red meat in particular, your red meat intake above 12 to 18 ounces per week does show an increased risk for colorectal cancer specifically, as well as with processed meats. The research doesn't put, a limit or a recommendation other than it's best to avoid processed meats. So think hot dogs and bacon and things that are either smoked, cured, highly salted, or they may use chemical preservatives. And some of those things have been shown to be a risk for cancer in lab studies. So this is one of the very specific groups to a very specific type of cancer that the research is showing right now. This is something we want to kind of watch out for. So, think of meat as a side dish, not the main part of your meal. We need to start thinking about plant foods as the main foundation of our diet. Try to go meatless a few times a week to help, start to reduce a little. You do not have to be a vegetarian or a vegan, but you do need to try to restrict these foods in your diet.
Jen,
All right.
before
Yes.
we go on to the next slide, I think this is important and it's also very timely because this is your second reference to colorectal cancer.
Sure.
And I'm sure our audience is very intelligent. They may have seen this as well, is that just a few days ago, may have been last week, there was a lot of press around the increase in colorectal cancers in a younger population, which is really scary. And I recently told my two 20-year-olds that, they in their 20s, make sure you eat fruits and vegetables because the age is getting younger and younger. So I think this is, I'm glad that you have this in here. Thank you.
Yes, absolutely. So both, looking at your intake here as well as managing your diet and managing your body weight. So exercise, plant foundation, plant foundation diet and minimal amounts of these foods for sure. Yes. All right, next slide. And I promise this is the last one where we're going to focus on, or then we're going to do all the positives. But this is another one where we've come a long way. So alcohol is the third leading modifiable factor that can increase your cancer risk. The reason being that alcohol breaks down into something called acetaldehyde, and that is a carcinogen, which works by damaging the DNA, but also prevents your body from repairing the damage. So once you have your DNA can be damaged, you have the propensity to have out of control cell growth. Alcohol increases risk for several kinds of cancer, including breast, again, with colorectal, esophageal, mouth, pharynx, larynx, and stomach. The good thing is that lots of companies, brewers and winemakers, are starting to make lots of options for alcohol-free drinks, so you can still have the social aspect of, you know, happy hour and celebrations, and just without the alcohol. And they actually, I've tried several, and an IPA tastes like a good IPA. You're just without the alcohol, which is the part of concern. So the picture I have on the slide is some of the options available, but it's something to check out. You know, it's kind of, once you try these things, it may be an easy kind of thing to cut out of your diet, because this is another one where we used to have moderate amounts, and the current recommendation is to avoid it if you can. There's no considered safe amount of alcohol. All right, next slide, please. Okay, so this is really where we need to focus. So if, you know, to hear all these diet recommendations, if you're going to do one thing, focus on eating more plant foods today. The other things will fall into place naturally when you start to do this. At least 2/3 of what we eat in our diet on a regular basis should come from plant foods. So your whole grains, fruits, vegetables, beans, legumes, nuts, olive oil, things like that. Reason being, they are high in fiber, they are high in vitamins and minerals, and in phytochemicals and antioxidants that are known to reduce our risk for cancer. So in addition to having all that good stuff in them, they're also low calorie and high fiber, which helps you manage your weight. So it helps on that other risk factor as well. Next slide. Now, this is another slide that's a little wordy, but I wanted to show you. So you're on the left, what you're looking at is these are biological process for protecting cells from having the initiation of cancer and the progression of cancer. So these are different processes in that. On the right, you have a list of some of those protective substances that are in our healthy foods that support those processes. So I think this illustrates, you know, what we say often is eat the rainbow. Make sure you have lots of color in your diet, because where you see their carotenoids, that's yellow and orange foods. Where you see sulforaphane, that's your cruciferous vegetables, your broccoli and your cabbage and cauliflower. Where you see lycopene, that's the red, the tomatoes, the strawberries. So it's just the more variety in terms of your plant foods, the more likely that you are to have a very protective, nutritious diet. Because I always say, you know, people always ask me about superfoods. It doesn't, any one food isn't going to harm you or help you. We are our habits, you know, you're not what you eat, but you're what you eat all the time. So when you develop this style of eating where you really focus on the plant foods as a habit, that's where the protection comes from. All right, and the next slide.
And that actually looks really good, that salad. It's like,
it looks great, right? I know it might be a little labor intensive, but it looks like a really good lunch.
Does look
Yeah,
good.
yeah. So On the next slide, you'll see popular diets that fit these recommendations. There isn't, everyone's always, what's the best diet? Well, there are a lot of diets that fit the pattern of eating that the American Institute for Cancer Research and ACS and even American Heart, American Diabetes, we're all kind of making the same recommendations. There's lots of diets that fit the pattern. The pattern is important. So flexitarian and Mediterranean diets will have, they will include things like chicken, as you can see there, and other animal foods. And then the other diets are different versions of vegetarian and vegan. And the protection really comes from the pattern, the focus on the plant foods. But these are all healthy. These are all, particularly the Mediterranean diet has lots of research behind it. And I like that one. I think it's the least restrictive, unless you're already, following a vegetarian or vegan lifestyle. Mediterranean is a good place to start because you're still eating all the food groups. It's just in different proportions. So I would look there. So from here, and like I said, these are the recommendations for cancer prevention as well as survivors. So you're a survivor, consider a survivor from the time of your diagnosis. But as you all know, if you've been through cancer treatment or if you're in it now, this would be a very difficult diet for some people. And because of what we're going to talk about on the next slide, next few slides, we can see, we're going to talk about these nutrition impact symptoms. So as an oncology dietitian, this is really where I would say 9 out of 10 of my appointments are. We are trying to work with patients to mitigate these things. These are the common side effects of cancer and cancer treatment that affect nutrition. They affect your ability to just eat, to have an appetite, to swallow, to digest and absorb foods, or just enjoy food in general. So we know that I kind of go into all of my appointments and all of my patients knowing that the patient's best chance for meeting their treatment goals is to be able to endure the treatment as prescribed. So these things are things that can interfere with treatment, with tolerance. They can cause delays in treatment, reduced dose, things like that. So I always kind of go into every patient appointment thinking, all right, how can I best use nutrition to help this patient stay on course and have the best outcomes possible? So in that way, I always encourage my patients to understand that their nutrition is part of their treatment and their therapy for their cancer. These things, obviously, if you've ever been nauseous or if you've had diarrhea, you do not want a high fiber diet like I just talked about. So when patients are in treatment, we encourage them to try to eat that way until any of this interferes with that, and have the flexibility to maintain your diet. Often we are putting people on low fiber diets. We are having them eat more often in smaller portions than we would on a normal diet. There's lots of eating more concentrated, eating high calorie foods, ways to add more calories and add more fat, where normally we are trying to be moderate with everything. So this is, and we can go to the next slide. And then the next one, we'll talk about malnutrition, because all of what we are doing is to try and mitigate this. Next slide, please. Okay, when I say malnutrition, and if you Google image malnutrition, you will come up with, photos of people in third world countries where there is starvation and famine, and they look very skeleton-like. But in chronic disease, like cancer, malnutrition, and this, as the slide says, looks can be deceiving. It may surprise a lot of you, even those of you who are in the medical profession, to know that about 80% of cancer patients will suffer malnutrition at some point along the course of their treatment. Malnutrition is not, not necessarily something we always see visually. So as dietitians, we diagnose malnutrition by looking for certain criteria. So we'll look at what is the patient eating compared to what we know they need, and how long have they been eating that way. What is their weight loss in periods of time to determine if it's, when it's significant. And then we look for signs of loss of muscle. So in the first gentleman, he's very handsome and well-dressed, but if you look kind of around his eyes, I can see, and around his cheekbones, I can see some loss of fat and muscle there. So we look for visual signs, and as well, the last thing would be edema. And if we find any two of those significant things, we will diagnose malnutrition. So it's not always that person who is clearly, bones showing and very thin. Okay, next slide. This is what we do look for, okay? It's more about the signs. How are you feeling, okay? So if you know you're not eating well, that's something you want to bring up with your cancer team. A lot of times I will hear, oh, I had the weight to lose. I had a few extra pounds. What I would like everyone to know about malnutrition, especially in oncology, is that you can be living in a large body. You can be living in a body with a BMA in the obese category and still be severely malnourished. Mm-hmm. So we really need to pay attention more to what are you eating? How fast have you been losing weight? Do you notice loss of muscle? Frequently feeling nausea, vomiting, or diarrhea means you're not getting those nutrients in. Slow healing wounds, extreme fatigue, swelling, fluid building up, especially in your lower extremities, and getting sick more often. And the reason these are concerns for during cancer, it reduces your tolerance to treatment. You may incur more risk of infection, longer hospital stays, more frequently being admitted to the hospital, higher healthcare costs. You can lose muscle, which is dangerous during treatment, because having higher muscle mass helps us better tolerate treatment. So lots of effects there. Next slide.
Jen, before we go on, I think the slide is really important, the one that you just shared as well.
Sure.
And it's also about like sensitivity for people,
yes,
like the caregivers. So you had, I want to share two examples. One is I have a wonderful close friend who's currently going through cancer treatment again, and she struggled with a lot of weight gain, but a lot of it is medication related. So others make insensitive comments like, oh, you think she'd take better care of herself because she's getting, heavy, but they don't know the reality of what she's going through. And then a personal story that I've shared a couple of times with myself is when I was going through cancer treatment, I lost a massive amount of weight, and I'm a small person. So I look like, I said, with my wig off, I look like a skinny 12-year-old boy. But, when I put my wig on and makeup on, everything else, and this is awkward to say, but I think it's important, is I was getting so many compliments. You look great. You must be working out. And I was very private at the time, but I was actually very, very ill. So we don't really know what a cancer patient looks like. So this is very, very educational for all of us, Jen. Thank you.
Good. Thank you. Yeah. Oh, a whole other topic is weight bias in oncology. Yeah, it's another important topic, but I do hear that a lot, especially from the women. And I think, we still have it such a diet culture that applauds weight loss, and yeah, definitely good.
I mean, and I don't think that people were being rude to me. I mean, I'm not.
Oh, right. Right.
It's like, well, I look thin because I actually have lost like 35 pounds, but I'm very ill,
Right.
So, and I'm,
exactly. Right. Oh, yes. I know we people try to be nice, but we should all stop commenting on others' weight change.
Exactly.
All right. And then lastly, something, and not clinically, but what we find ourselves as dietitians doing, I would say a lot more in the last few years, is working with patients who are food insecure. I ask all of my patients in my initial assessment, do you have concerns about affording or accessing food? You would be surprised at how people who say yes. Cancer can be financially devastating to anyone. You could have been, middle class, upper middle class, and things can change very drastically, and you need more support. So something we do find with that we're doing more as oncology dietitians is supporting patients with resources to find food. We try to get them samples and coupons and discuss, eating on a budget. So if you think about, all the amount of cancer survivors, and then you think about the rates of food insecurity, there's some overlap that I don't think the research is clear on, but I would say I am seeing this more often.
And
So
Jen,
another,
I'm sorry, go ahead.
Oh, go ahead, Rose.
No, for the audience, Jen and I talked about this, we're having discussions, this goes along. This also ties into the larger issue that we've also educated the audience about through COA's work as well, is health equity. So
Yes.
health equity is addressing a lot of this food insecurity issues, and you use the word surprised. Yes, I've definitely been surprised, and it's not always a stereotypical person who you think it needs help buying groceries. So it's really great to see this being done as well, and that you're bringing this up with patients in a safe environment.
Exactly. And I always very careful about my elderly patients. Is sometimes, I have a lot of patients, as a dietitian, I work with patients who have pancreatic cancer. They require a medication called Creon, pancreatic enzyme that helps them digest and be able to absorb the fat in their food. And it's critical for many people, and it does not have great coverage. So a lot of times when I see patients who are on that, I do find, otherwise we're doing great, but that now the cost of this drug has them, choosing do I take the medication that I need to be able to eat, or do I buy the food and hope for the best? And so you always want to pose this question, whether you're a dietitian or social worker. We have a lot of resources on our AON patient resource website that we see patients all over the country, so they can look up their zip code and find local resources. And there are a lot of people out there who want to help people with cancer, and churches and local organizations. So it's always good to look into for people. And now we'll finish by talking about advocacy. So we'll go to the next slide. And then the next one. So I hope through our talk, you can see that every cancer patient should have access to a qualified registered dietitian. The issue and why, if you have been through a cancer treatment experience and you haven't seen a dietitian, is we are often reserved for only the patients most at risk. And the reason being, and actually the study that you see here, they found the dietitian to patient ratio in outpatient treatment facilities where most people are treated is 1 dietitian to every 2,300 patients.
Wow.
So almost at AON, we're very lucky, and I can have those survivorship meetings with patients and talk about weight management, and we don't have restrictions on who we can see, but that is rare. And usually where I've worked before, we screen for malnutrition and we only see the patients at risk because of our staffing. So the reason for this is reimbursement. So if we go to the next slide, since you're all advocates, I want you to be aware of the MNT, or Medical Nutrition Therapy Act of 2020. So right now, Medicare only covers services with a registered dietitian for 2 diagnoses, diabetes and then kidney disease, under certain circumstances. This bill, which has been introduced in both the House and the Senate, will expand that to cover a whole host of conditions where nutrition is critical, including cancer and malnutrition. That would mean, that any cancer patient would have access to a qualified registered dietitian. So I would encourage you to check out congress.gov and also the Eat Right Pro for advocacy and more information there. And last, I just want to leave you, we kind of touched on this earlier in the last slide here. There's a lot of information about nutrition. You get a lot of advice, well-meaning, I'm sure, from friends, from family, things on the internet. There's a lot of, fad diets and really inaccurate and sometimes dangerous information, especially when it comes to taking certain supplements. So just here are some 3 really good resources, and make sure, if you don't have access to a dietitian, that you are asking at least, your oncology team for resources of where to go, because it can be messy out there. A lot of confusion. Are there any other questions or anything come in, Rose?
No, but thank you. This has been very, very educational. I think it's perfect that our title slide was evidence-based nutrition and
Yep.
your final slide is evidence-based. So
Yes.
this has been wonderful. Thank you so much. And Drew, if you can go to the next slide, please. We always get the question, are the slides available? They will be available on our website in the next few days, and they're immediately available on Facebook Live. Thank you for being a part of this, Jennifer. That was an outstanding presentation. Please join us next month on Wednesday, April 12th at 12 p.m., where our special guest is Audrey Davis, Director of Health Equity from the incredible organization Cancer Support Community. And I'm looking forward to that topic too. Thank you all for being part of this, and enjoy the rest of your day.